Hi, everyone. Thank you for joining us today. My name is Nari Rojas. I'm a policy analyst at ChangeLab Solutions. A couple of housekeeping notes for participants. On the left-hand side of your screen is an Ask a Question box. If you are having any technical difficulties during the webinar, send a question through this box and we'll try to help you out. We are planning on leaving time at the end of the webinar to answer a couple of questions. Throughout the webinar, you may submit questions for presenters in the Ask a Question box. If your question is for a specific presenter, please remember to identify them in your question. The webinar will be recorded and sent out with a PDF of the slides to all webinar registrants next week. That's it. As I mentioned, I'm with ChangeLab Solutions. We're a national organization that advances equitable laws and policies to ensure healthy lives for all. We prioritize communities whose residents are at highest risk for poor health. Our multidisciplinary team of lawyers, planners, policy analysts, and other professionals works with state and local governments, advocacy organizations, and anchor institutions to create thriving communities. First, a quick disclaimer. Even though we may discuss legal and policy issues, ChangeLab Solutions does not enter into any attorney-client relationships, and none of this presentation is legal advice. We are very excited to have a wonderful group of people with us today to speak about policies to reduce sugary drink consumption and their equity considerations. As I mentioned before, I'm a policy analyst at ChangeLab Solutions, where I focus on issues that affect public health, including healthy housing, childhood obesity, and healthy planning. Before joining ChangeLab Solutions, I worked at the School of Public Health at UC Berkeley, leading research projects to evaluate sugary drink taxes in the Bay Area and assisting with several projects related to the prevention of childhood obesity. Sabrina Adler is Vice President of Law at ChangeLab Solutions. She works primarily on legal and policy issues related to preemption and good governance, the commercial determinants of health, and healthy children and families. She has co-authored publications and presented on many issues at the intersection of law and public health, including sugary drink policies, food policy, preemption, and health equity. Jim Krieger is founding executive director of Healthy Food America and clinical professor at University of Washington Schools of Medicine and Public Health. He has provided technical assistance for adoption, implementation, and evaluation of sugary drink policies in over 40 cities and counties in the United States. Javier Morales is Executive Director of the Praxis Project, a national organization dedicated to supporting communities building power for health. He was part of the strategy team that developed and organized to pass Measure D, Berkeley's groundbreaking soda tax, and he has also served on the commission that makes recommendations on how to invest resources in community initiatives. Here is a quick overview of what we're planning to cover today over the course of the webinar. We'll be going through why reduce sugary drink consumption, what are strategies to reduce sugary drink consumption, how to design a tax policy with equity in mind, and how to center community leadership in the process of designing and implementing taxes. To get us all on the same page, we're going to start with a definition of health equity used by the Robert Wood Johnson Foundation. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. Now I'm going to pass it over to my colleague Sabrina Adler to start us off on why it's important to reduce sugary drink consumption and strategies to reduce sugary drink consumption.
Thanks, Nadia. So first, why reduce sugary drink consumption? Well, it probably won't come as a surprise to most of the people listening to this webinar that sugary drinks are bad for health. Specifically, liquid sugar is easy to consume in large amounts without making people feel full, so that means they end up consuming more calories. And there's also a lot of evidence that shows a relationship between the consumption of sugary drinks and chronic diseases like type 2 diabetes, obesity, heart, liver, and dental diseases. These diet-related diseases are epidemic in the US, and they disproportionately affect low-income populations and communities of color. So people with low income, African Americans, and Latinxs consume more sugary drinks than white and high income people, and this is driven by a number of factors, including the predatory marketing of sugary drinks that targets these populations directly. So for all of these reasons and more, the public health community sees reducing sugary drink consumption as a way to improve health and address health inequities. Obviously, the primary thing on almost everyone's mind right now is COVID-19. There's just so much going on, and we're facing such extreme challenges, both in combating the pandemic, but also trying to understand and then address the fallout from it, from the economic consequences to the public health consequences and beyond, that we'd be remiss, I think, in not asking whether it makes sense to be discussing sugary drinks right now. But we and many of our colleagues, both those who are joining us on this webinar and otherwise, feel that there are a few reasons why it's important to continue work in this space. So first, as the evidence emerges about who's being most heavily impacted by the coronavirus, it's clear that the same health conditions that are associated with sugary drink consumption, so those that we just mentioned, like diabetes and heart disease, are associated with worse outcomes from COVID-19. As a result, it's those same communities, namely low-income communities of color, that beverage companies disproportionately target with sugary drink marketing, that are suffering disproportionately as a result of this virus. This isn't a coincidence by any means, and addressing sugary drink consumption is one way in which we can continue to tackle these inequities that are playing out so starkly during this pandemic, and that will continue to do so in other contexts unless we take action. Secondly, this is also a time when government, and particularly state and local government, will likely be doubling down on public health at the same time that they're in desperate need of funds to support core services and to aid local communities in the recovery effort. So particularly when it comes to taxes, which we'll spend some time talking about today, the revenue that they provide offers a chance to shore up infrastructure and provide critical services, particularly in low-income communities of color. So before I dive into specifics about strategies, a bit about policy generally, which is a focus of ours at ChangeLab Solutions, just to make sure that we're on the same page, a quick definition. So when we talk about policy, what we mean is generally a written statement of an organizational position, decision, or course of action. These policies have advantages because they're generally binding, and they set out general approaches to be applied widely. They can be made in the public, nonprofit, or business sector, so we could be talking about state, local, or federal laws, but also things like school district policies or hospital policies, or even organizational or company policies. We see policy as an important means to change for a couple of reasons. First, it offers accountability and enforcement. Second, because it's required and not voluntary, it reaches more people. And finally, because it institutionalizes good ideas. I do want to mention that in spite of the fact that we're talking about policy as an important goal, the non-policy work is also really important for getting to policy. So just because we see policy change as that end goal doesn't mean that programmatic systems and environmental change work isn't important in setting the stage for that. I also want to emphasize the importance of people-centered policy, meaning policy that's developed from the ground up and really involves the community, but I'm not going to go into any detail on that because Jim and Javier are going to spend some time talking about that piece as well. I also want to mention the concept of preemption because it's something that's increasingly coming up in the context of sugary drink policy. Preemption, for those who aren't familiar with the term, is a legal doctrine that allows a higher level of government, so state or federal government, to limit or even eliminate the power of a lower level of government to regulate a certain issue. Preemption can have different effects on policies that promote health equity, but in this context of sugary drinks, it's most often being used to block equity promoting local policies. So you may be familiar with what happened in California in 2018 when the industry more or less blackmailed, and that was the word that many legislators used, the state legislature into preempting any new sugary drink taxes in the state. I'm not going to go into more detail about exactly what happened there, but I do want to flag this issue We have many resources on preemption on our website at ChangeLab, and I'm also happy to answer more questions about this at the end. So now I'm going to dive into some specific strategies to address sugary drink consumption. These strategies come from our sugary drink strategy playbook, which we drafted some years ago now, but updated more recently in 2018. The revised playbook goes through all these strategies, but it also includes features on health equity that really hone in on the equity considerations of each strategy, including challenges. It talks about collaboration and engagement, ways to generate support. It also gives examples of these strategies in action in various communities around the country and lists key resources for leaders who want to learn more about each. So the poster you can see on this slide includes the strategies that are outlined in the playbook, but I know that some of the text is a little bit small, so I'll just go through them. They're organized roughly in order of sort of low-hanging fruit to much more challenging and maybe emerging. So obviously the context is going to be important in determining what makes sense in any particular community. So first we have launch a public awareness campaign. Second is start a healthy retail store program and establish healthy checkout aisles. Build on federal standards to expand sugary drink restrictions in youth-oriented settings. Restrict marketing of sugary drinks in schools. Eliminate sugary drinks from kids' meals. Limit sugary drinks through government and private sector procurement policies. Reduce sugary drinks at anchor institutions. Tax sugary drinks, and adopt cutting-edge sugary drink reduction strategies. So I'm not going to go through each of these in detail, but I want to hone in on a few as examples. So first, building on federal standards to expand sugary drink restrictions in youth-oriented settings. As a side note, the numbers you see on this slide, the slides here correspond with the order in which these strategies appear in the playbook. So kids spend a lot of time in childcare and schools, usually, even though they are not at the moment, where they may be exposed to sugary drinks. And kids who are in childcare and after-school programs that receive government subsidies or who are provided food at school through a government-funded program often come from families that are at high risk for chronic disease. So that means that these settings in particular are important focus area for sugary drink reduction strategies to advance equity. These feeding programs that operate in these settings, including things like the National School Lunch Program, are governed by federal nutrition standards, but states and localities can and have built upon these standards. So for example, they can adopt federal standards locally to protect them from rollback. This is a really important piece, and the reason I actually decided to discuss this particular strategy is because it's an issue we're seeing at the moment. So federal regulations can be put into place, but they can change with new administrations. And we're seeing this administration attempt to roll back school nutrition standards, for example. So adopting these standards locally helps to guard against these sorts of rollbacks. And in addition, because the federal standards are minimum, states and localities can go beyond this baseline. The second way that states and localities can act is by closing gaps. So for example, federal school wellness policy standards don't require schools to implement nutrition standards for events outside of the school day or at school-sponsored fundraisers. So to address these types of gaps, the school district or state could decide to enact policies that apply to school events that occur outside of the school day, like football games or dances. And then finally, they could include coverage to include more children and youth. So for example, some childcare settings aren't participating in the federal food programs, and policymakers and change makers could consider policy strategies to address sugary drinks at sites that aren't covered by federal law. Next, I want to talk about eliminating sugary drinks from kids' meals, and this is a policy that's gained traction in a lot of states and communities. So underserved communities in particular often have limited access to high-quality foods, and restaurants and fast food outlets may fill this gap for families, but as we know, they generally provide meals that are low in nutritional value. Eliminating sugary drinks from kids' meals can be accomplished in several ways, through voluntary initiatives or even a policy that requires that the default beverage included in a kid's meal be a healthier option, like sparkling water or milk with no added sweeteners. Under this type of policy, a sugary drink could be sold with a kid's meal, but only if specifically requested by the purchaser. So a lot of fast food chains and restaurants have already voluntarily implemented healthy kids' meals, we've seen mixed results with these voluntary initiatives when it comes to implementation. So you may be familiar with the recent wave of state and local laws that require healthy drinks with kids' meals. That has turned what was previously only a voluntary approach into an enforceable local or state policy. ChangeLab Solutions has model state and local laws for healthy kids' meals. They include a variety of approaches that can be tailored, and they're all available on our website. So I'm not going to talk a lot about taxes because Jim and Javier are going to spend a lot of time talking about it, but I'll just provide a very high-level intro, which is that taxes can nudge consumers towards healthier options by raising the price of sugary drinks relative to healthier options. And very importantly, which we're going to spend some time talking about, they can raise revenue that can be directed back into those communities that are disproportionately harmed by sugary drinks. What I will flag right now, before I let Jim and Javier dive into the meat of this, is that we, in partnership with Jim's organization, Healthy Food America, developed a guide to designing sugary drink taxes, which covers a lot of the important features of those taxes, and which I think Jim will be discussing, but is also available on both of our websites. Finally, the playbook ends with a list of emerging sugary drink strategies, many of which are listed on this slide. So things like requiring proportional pricing, setting minimum prices, making water more attractive at restaurants, licensing sugary drink retailers, and requiring warning labels. We call these emerging because most have not been tested yet as policies, but I wanted to mention them as folks think about the range of what might be available and what might be new on the sugary drink policy front. And if folks have questions about specific approaches that are here or others, I'm happy to answer questions during the Q&A. So there's a lot to say about the many sugary drink policy approaches, and we don't have a lot of time to go into depth on each of them. But ChangeLab Solutions has a number of resources available on our website, and I'd encourage you to check them out or to reach out to us if you're interested in pursuing any of the strategies I've mentioned or have additional questions. We have more than what's pictured here on this slide, and I'd be more than happy to point you in the right direction. But now I'm going to hand things over to Jim to really dig into the issue of sugary drink taxes.
Great, thank you very much, Sabrina. And thank you to ChangeLab for organizing this webinar. It's great to be part of such a widely attended webinar. There looks like more than 660 people on. And that's despite the challenging times we're living through. As Sabrina mentioned, COVID-19 is affecting everything. And among other things, it's a potent health equity lens. And it shows us once again the structural forces and diseases that are creating disparities in diabetes, obesity, tooth decay, and heart disease, the very same risk factors that exist for COVID. So SSD work remains important. And what I will do this morning with you, or afternoon, depending where you are, is to share briefly with you the current state of tax implementation and discuss suggestions for equitable tax policy design based on a group that Javier and I convened called the National Tax Equity Work Group. Just a quick mention of Healthy Food America. We are a nonprofit organization that uses science to push for changes in both policy and industry practices to create healthy and just food environments by providing technical assistance, research, and conduct advocacy. I was also, as a personal note, one of the leaders of the Seattle's efforts to adopt the sugary drink tax and served as its chair of its community advisory board for more than 2 years. There are currently 7 SSD taxes in effect in the U.S., and they reach nearly 4 million people and are generating $135 million a year in revenues for those communities. The first tax was implemented in Berkeley a little over 5 years ago now. Globally, there are more than 40 nations that have adopted taxes. It's a rapidly growing movement. And part of what's driving this is there's an emerging body of evidence now that is showing that taxes have the desired effects, and the ones that are predicted. They're reducing sales of sugary drinks. For example, this slide shows that after adoption of the tax in Philadelphia, in the orange, sales of tax beverages dropped dramatically by 38%, whereas there was no change in the blue line, which represents Baltimore, the comparison community where there was no tax. Mexico was one of the earliest countries to adopt the tax, and in its second year, at the end of the second year of the tax, sales had dropped by about 10%. The tax was less than the one that introduced in Philadelphia, so the amount of decline was smaller. But this was a substantial decline, and noteworthy because it was a larger decline among people of lower socioeconomic status, 14% decline compared to those who had higher socioeconomic status, which is about 5 to 6%. So going to the topic, though, that I'm primarily going to focus on, what does a progressive tax policy look like? I thought it'd be helpful to just review a little bit about what makes a policy progressive. There are a couple of attributes, some of which I've listed on this slide, is that a policy is progressive if it promotes health, economic, and social equity, that it benefits people of low incomes to a greater extent, that it addresses the root causes of social and structural inequities, and that increases community capacity to drive towards equity and make changes in their communities they desire. Taking this progressive policy framework, Javier and I convened what we call the Tax Equity Work Group, which is developing recommendations for equitable sugary drink tax policy design. There's 16 organizations, all of whom have experience on the ground, both with equity issues as well as with sugary drink taxes, and they're contributing ideas about what equitable taxes look like, both from a policy design perspective, but also from how taxes are adopted and implemented. While our final report will be out this summer, I'll share a preview of what we've been talking about. And please note this is preliminary, and the organizations participating have not yet reviewed or approved any final recommendations. It's very much a work in progress at this point. We've concluded that a sugary drink tax is a progressive policy when properly designed. When properly designed, a sugary drink tax will benefit people from the communities most harmed by sugary drinks and the beverage industry. It will invest tax revenues in these very same communities and engage them in leaders in tax design and implementation. It will build community capacities and change attitudes and norms, leading to long-lasting benefits for the community. So here are some specific ways taxes can be designed to promote equity, and we encourage anybody considering doing a tax to take a look at these. First, the tax legislative intent, which lays out usually in any tax bill why the taxes or the bill is being passed, should make equity a priority goal for the tax. Second, the revenues should be invested in the communities most affected by SSDs, those marginalized communities that are subject to predatory marketing by the industry and where consumption rates remain high and where sugary drinks are everywhere in the environment. The revenues should be invested to reflect the values, the needs, and the priorities of these communities and address the health conditions caused by sugary drinks. And they should change the social and economic determinants of health, causing health inequities and other social inequities. Communities should be able to benefit from these as well by using the investments to grow community power and capacity by supporting community-based organizations. They should support advocacy for policy change and systems change aligned with community values and priorities. Next, the community should have a significant role in determining how revenues are allocated so that they meet these goals. There are a couple of ways that taxes can do this in terms of the bills. One is they can establish community advisory boards with the majority of members from affected communities, and I'll go into this a little bit more in detail later. They can have other community engagement processes, which I'll give an example of, and they can be sure to inform the community about tax implementation, revenues, and allocations so the process remains accountable to the community. Second, equitable revenue allocation processes can be adopted and specified. Funds can be distributed through grant-making processes that stress equity and fund CBOs from affected communities. And we use equity-based criteria to guide the use of funds. And finally, tax evaluations can focus in on equity-related impacts to make sure that taxes are indeed having equitable effects. What's being funded? Who's benefiting from the funded activities? What are the benefits from the tax and who's benefiting from them? Not just around consumption and sales, but also around multiplier effects like jobs. And also to pay attention to unintended consequences that might be counter to equity. In addition, some other specific things might be considered. If there's a state-level tax, which many states are considering right now, it still is important that a portion of those revenues gets passed through to communities, because Communities have more power and capacity at the local level and the ability to shape allocation of revenues equitably. And so these processes that I just talked about for taxes are more likely to happen at the local level, and so having some of the revenues from the states go through the locals is important. Also, it's important to establish a segregated fund where the tax revenues are deposited. And this means taking them out of the general budget where they can be used for any purposes and placing them in a special fund so that they are used as originally intended and as originally promised to the community when the tax was adopted. There have been a couple of cities in which mayors have tried to divert funds to other uses, so protecting them in a special fund is good practice. In addition to the tax policy itself, how the policy gets passed into law is important as well. So looking at the campaign and the adoption process and making sure that's equitable as well. A couple of suggestions there. One is making sure that community is involved from the beginning of any tax process, including whether or not to even do a tax in the community, designing the tax bill, planning the adoption campaign, and advocating for adoption. And as I mentioned before, informing the community all along the way with what's going on, as well as the effective businesses, will both build support and trust for the tax as it moves forward. So now I'm going to move on to some specific examples around revenue investment, just to show that when done well, taxes can really support equity-focused, equity-centered activities in communities. For example, in Seattle, the primary focus for investments is in improving access to healthy foods and improving food security for people with low income. So the biggest single investment in Seattle is providing cash incentives and vouchers that let people buy fruits and vegetables at discounts. The tax has supported an existing program by expanding it, growing it, by making the income eligibility threshold higher, by adding more and more Safeway stores so people have greater choices of where to use their benefits, and by removing any limit on how much match people get, how much incentives people get. $3 million is now budgeted for this fiscal year, and 6,000 people are being served. However, an additional allocation was made in response to COVID from tax revenues. And I think it's a good example to show how taxes can promote equitably focused investments during COVID. Additional $6 million was added to provide COVID grocery vouchers for low-income families during the COVID-19 episode. $800 for 6,250 additional households has been funded in Seattle. In Philadelphia, a big focus has been on early childhood and pre-K. So access to high-quality pre-K has been accomplished by subsidizing costs for families, and namely 2,250 new pre-K seats, primarily for children of color and low-income families, and also by supporting minority and women-owned businesses who provide pre-K. In San Francisco, revenues are being used for many purposes. An interesting one is focused on addressing some important social determinants of health, in this case, developing jobs and businesses and supporting minority-owned businesses through a neighborhood revitalization program in a low-income, historically African-American neighborhood in San Francisco, Bayview, Hunters Point. And finally, another example in terms of addressing social determinants and an innovative approach is in Boulder, where revenues have been invested in the legal aid group to provide free legal assistance around Medicaid, getting signed up for SNAP benefits, getting signed up for health insurance, and in general, providing legal assistance for low-income people in Boulder. One of the reasons that revenues have been allocated and invested equitably is because there have been strong community advisory boards in 5 of the 7 cities. For example, in Seattle, the Community Advisory Board recommends how to allocate the revenues and has a strong equity focus in how it makes its recommendations. The Community Advisory Board in Seattle includes community advocates as well as people with expertise in healthy food and food security, early childhood, and public health. And 2/3 of the members of the Community Advisory Board in Seattle are people of color. The Community Advisory Board has sponsored additional community engagements to try to broaden the community in participation in revenue allocation decisions through community surveys, through community forums, and now through funding community-based organizations with deep ties to the community who will be reaching out through their own networks to engage more and more community residents in these discussions. So I'm going to conclude here by saying that, yes, I believe, and we believe from our tax equity work group, that SSB taxes are indeed a progressive policy when done right, and that's particularly following some of the principles that we've developed, Seattle, the sugary drink taxes can be important policies. They can, just to recap, investing revenues to develop the people most affected by SSDs, to respect community priorities and values, to address the social and economic determinants of health, to support authentic community engagement and leadership from the impacted communities throughout the whole policy process, and to enhance community capacity and agency to improve health that goes beyond the tax revenue investment. So now I've got the pleasure of introducing a friend and a close colleague, Javier Morales, who leads the Practice Project and is a well-known and influential voice for equity. We're working together with this tax equity work group to demonstrate how soda taxes can go a long way towards improving health equity. He's going to share his experience as a leader of equity work in general and SSD tax work in particularly in Berkeley. So I'm going to turn it over to you now, Javier.
Thank you, Jim. And I want to thank the folks from ChangeLab for the invitation to be with you today, and also, again, to Jim for his continued partnership in efforts to center health equity in local policy. And just for reference, I'm coming to you as I spatially distance while working from my office at home in Berkeley, California, the traditional lands of the Ohlone. For those of you who don't know us, Praxis works with base-building organizers across the United States to build power to address local health priorities. In fact, next week on May 7th, we're hosting a webinar on what we are calling organic public health and showing how base-building organizers actually have the same priorities to address health equity as many who work in government agencies and departments, and also our advocates programs. Our theory of change is simple. Help local organizations to build power to address their most pressing health concerns, help to resource these local efforts, and as power is built up on a particular issue, this same power, which is kind of like a community muscle, gets bigger and stronger, and the community can then use it to address other pressing problems. And over time, as we continue to improve community conditions so that everyone is healthier, we end up having a more just society. And many of our learnings regarding the power of community and the need for authentic partnerships actually originate from our work on passing soda tax legislation, as well as other measures to improve the policy systems and practices that underlie health inequities. We have seen that when communities are integrated into the tax design or policy design, implementation design, advocacy, and also help to decide how to invest funds, the success rate of the tax campaigns that center health equity is increased and goes up. Just so you guys know a little bit more about our lens, we have also recognized that working with communities, especially base-building organizations, many of whom work in the areas of municipalities with the highest rates of chronic disease, the least stable housing, lower incomes, basically where the determinants of health are not as robustly present, requires a level of trust building. We've got to remember, urban renewal, a lot of transportation projects, a lot of disinvestment that have happened has really broken trust with many of our communities. And Praxis has worked with our base-building organizations in our network to develop this set of principles that help to inform more authentic collaboration. And as those of us who carry the scars of taking on the beverage industry can attest, we will need to work in deep partnership, this is public health advocates and community together, to challenge the financial power inherent to our industry adversaries. And these 5 principles are: act with care, be inclusive, authentically collaborate, solutions should be sustainable, and lastly, commit to transform and be transformed. And I'm sorry that I don't have time to go into each of these principles in detail, but we actually have a much more in-depth brief on our website that describes each of these in greater detail. For now, let me assert that initiatives that incorporate these principles will result in policy successes that really do center health equity. In retrospect, and again, I'm applying this lens after the fact, and I should also give a shout out. I saw Vicki Alexander in the chat. Vicki Alexander from Healthy Black Families was one of the co-chairs for our campaign, our Measure D campaign in Berkeley. And I got to let you guys know that, it's a lot of her leadership that helped us to get the community trust and actually design a tax that worked for community. And this was why I think that we were successful. So in retrospect, it's easy to see that the elements of these principles in Berkeley's 2014 work to pass Measure D. The folks who first thought of passing a soda tax looked at, and what at the time was the field dogma, like the public health perfect, that said that if the goal is to improve population health by reducing consumption of soda, then research showed that unless the tax was a minimum of 2 cents per ounce, that the tax needed to be a dedicated tax, and this probably has more special meaning for folks in California that I don't have time to get into now, but just know that this meant that our threshold to win was 66% if we went on a specific tax as opposed to 50% plus 1 for a general tax. And that this tax needed to be a tax on the consumer to be felt at the register. This tax was designed to reduce consumption of sugary drinks by making it painful in folks' wallets, when they purchase the soda. Well, this approach was challenged. It had been tried quite a few times, and I remember being in some meetings and feeling like we advocates felt like the public would eventually catch up to this approach that we were putting forth. And I have to admit that when Berkeley's initiative first started, I was on this side as well, and it was through Vicky's leadership and others that helped me to see, no, there's a different way. Well, again, the leadership in Berkeley felt different. We wanted to win. And after speaking with advocates in other cities that had tried to pass a tax, our leadership took away the need to diversify who was sitting at the table working to design this tax. And again, this is a much longer story than I have time to relate here, but this more inclusive group recalibrated how we wanted to improve health in our community, especially the health of the residents that were bearing the brunt of the beverage industry's misleading health claims and their predatory practices. With this new, more diverse team at the table, we decided that the way we wanted to improve the community's suffering and suffering the greatest health impacts related to the overconsumption of sugary drinks was through changing norms by increasing knowledge in the community and making the healthier choice, water in particular, more attainable and available. And we wanted to change norms to be working with the groups that were closest to the population the beverage industry was targeting and who exhibited the greatest health challenges. So now that you know the background and the lens, let's apply this working principles for health justice and racial equity. And what you'll see is that as you look at the 3 columns here, the 2 columns on the right, the dogma, the previous perfect, was, an emphasis. Well, you can see when we break it down by the principle. Actually, I'm only going to go through the 2014 coalition because I'm going to run out of time if I do the full description here. But acting with care. The emphasis was on building relationships to show how this funding could advance local priorities and goals. Inclusivity. It was the intentional inclusion of communities of color, especially the ones that were most impacted by the soda industry. Authentic community collaboration. So here, community-led collaborative and community advisory board was established for the tax to help make recommendations of how the taxes should be invested. And also, the goal here was to fund those groups that were closest to the communities that were experiencing the brunt of the health impacts of the overconsumption of sugary drinks. Sustainable solutions. It's important to reinvest these funds back into the community to build knowledge, capacity, and infrastructure. In this way, we're not just reducing the consumption of sugary drinks by raising the price, but rather we are changing norms out in the community. And then the last one, commitment to transformation. When we sat around that table, there were a number of folks that were transformed as far as their approach to how to pass a local soda tax. I was transformed. I came over to the Vicky side and, really got centered in community. And, the community folks came in and started to understand that, this isn't something that's punitive. And if we can realize the vision of this tax and why we need it, this is actually something that's very good for us. So there was a lot of transformation that happened. So, this is a little bit of a restatement of what Jim said earlier. And so, these are the four things that were my big takeaways when it comes to health justice, health equity, and soda taxes. The first is, this is the way you make it not regressive, and it can actually be a progressive policy. You invest the funding in the areas that are experiencing the highest rates of preventable chronic diseases related to the overconsumption of sugared water. And Sabrina showed those very, very early on. The second, invest in community-defined priorities. Now, sometimes what the community defines may be a little bit different from what we may think is important for them, but the communities need to define their priorities. And I'm going to flip over to this other slide for just a second, and we actually appreciate when these investments go into any one of these the darker texted determinants. These are the determinants of health, and for us, investing in community safety improves health. Investing in education and justice improves health. Investing in youth development improves health. So for us, investing in any of these things, that's what the community is defining as needed, and we believe that that's where the funding should go. The next slide is, community should be part of the solution. This investment should go back into the communities that are experiencing the brunt, the organizations that are closest to the communities that are experiencing the brunt of the poor health due to overconsumption of sugary drinks. And then lastly, there should be capacity and infrastructure left behind. Let's say, because we know that some of the funds, if they're successful, and we do reduce the consumption of sugary drinks, that over time the revenues will probably decrease. So we want to make sure that we're actually investing, building capacity and infrastructure in the community that transcends our grant period. This is how we become sustainable over time. And so I'm really happy to show you guys these next two slides, and I think you guys are all going to get slide decks, and these are actually links. When you click on them, it's going to take you to some videos that we've produced to show just the power of this funds going back into our communities. And so this slide right here, this is the story of Berkeley Unified School District using their funds for gardening and cooking programs. This is the funding that goes to Healthy Black Families. They've been doing incredible work on not just community development, but also folks doing cooking programs and exercise programs. It's just incredible the way they've been able to use these funds in a community that's diminishing. As the gentrification increases in Berkeley, it's really important for us to continue to invest in our community. The Multicultural Institute has taken their funds, and they go out and they work with day laborers and the family of day laborers to do nutrition education and show just that folks should be drinking water and the dangers of drinking sugary drinks. It's pretty, and they also link them to other services, wraparound services like oral health care and things like that. This is like an incredible use of funds that these folks are doing here. And then the Ecology Center is doing a lot of work around shifting norms towards drinking water, and it's very youth focused. It's a youth development program, and it's beautiful what they do. And then the last one, we just released this video last week. This one's it's about the YMCA of the East Bay. They have a Head Start program, and they use our funding. We invest in them to do nutrition education. And I got to tell you that early on, this is a picture that was taken during our campaign. This was Precinct 2 in Berkeley. These are the folks that we went out with every weekend to try to get the tax passed. We were the ones that were trying to convince our communities that this was a good thing for us. We're outside of the Ecology Center, and there's a windowless meeting room that we were meeting in to strategize in. And I got to tell you that, starting in October of 2013 all the way through, let's say May, when we were designing the tax and haggling over exactly what needed to be in the tax design, these investments are exactly what we were envisioning. So I'm really excited for what we've been able to do, and I really do believe that we have centered community and that we really have centered health equity. Thank you. I don't know who to hand it to.
It goes back to me. Thank you, Javier. Yes. Well, Sabrina, Jim, and Javier, thank you so much for your individual presentations. It's been great hearing your common themes on how it's important to consider equity when pursuing this work. Now we're going to go on to the questions that have come up. Just a quick note, we're so excited to have so many questions. We don't think we'll have time to get to all of them, but I'll be working with the presenters on sending extra resources and responses to address many of the questions that come up. So why don't we start off with the first question. And Sabrina, this question is for you. What is happening regarding a California initiative on taxing sugary drinks?
Thanks, Nadia. So Javier, you can also weigh in here, I think. There is still a movement at the state level in California to tax sugary drinks. I think, you know, one major question that's coming up is around legislative priorities, et cetera. And as I noted at the beginning of the webinar, I think those of us who work in this space have discussed and I think are pretty aligned on the fact that continuing to push these policies forward, even in this time when there are so many competing things happening and so many urgent interests, is really important for a variety of reasons, which I mentioned. Whether legislators and policymakers agree with that, I think, is yet to be seen. Javier, I don't know if you want to weigh in with any more info on that work.
No, just that the work continues. There's a group of advocates. There's a coalition called the California Less Sugar that is continuing to try to advocate for a statewide soda tax, but in this era where, as was just mentioned, that there's diminished capacity. There's a shortened legislative cycle right now. You know, we're working hard to try to make sure that the bill gets heard. But you know, this isn't going to end. Even if we don't get heard, or if we do get heard and we don't move, this isn't going to be the end. We're very committed to continuing to try to protect the health of our communities. And so, yeah, that's where we're at right now. It's kind of in a holding pattern, waiting to see what happens.
Great, thank you. Our next question is, for a public awareness campaign, is there data on effective messages for youth or adults? Jim, did you have any thoughts on this?
Yeah, thanks, Nadia. And I saw there were a couple other public messaging campaign questions as well, so let me try to get to those also. There is a growing body of evidence around what messages work best for taking on sugary drinks, and I'll just give a couple of highlights of those. One is that graphically illustrating the consequences of consuming sugary drinks, particularly around diabetes and tooth decay, is effective. And so, contrary to previous kind of public health dogma, fear-based messaging showing that the consequences are severe, just like in the tobacco graphic warning work, seems effective. Second, coupling that with positive alternatives, such as drinking water, is helpful. And finally, calling out industry-deceptive marketing practices. People don't like knowing that industry is trying to deceive them in marketing their products as healthy when they're not. Another question said that there isn't evidence that messaging can decrease sugary drinks in a public awareness campaign. And actually, there is some pretty compelling evidence, and more is coming out. But there are evaluations of both the Live Sugar Free campaign in Appalachia, as well as one in Australia using an explicit counter messaging framework that have documented in rigorous studies that there's been a decline in sugary drink sales when those campaigns are run.
Great, thank you. Our next question is about pouring rights. So what about pouring rights as a strategy? Does it fit into the continuum? Do any of the speakers have any thoughts about this?
I can say a little bit about this. I'm assuming addressing pouring rights is what this person is asking about. But so pouring rights are generally a contractual obligation that is entered into between the beverage industry and, for example, restaurants, at least as I understand them. And certainly, you know, those can lead to political challenges in enacting policies that might affect those rights, though certainly some of these policies could affect what's in place in various restaurants, for example. If you're talking about working directly with, for example, restaurant chains to sort of renegotiate what those contracts say, then I think, there has been some movement in that space, but it can be challenging. There's economic forces in place, of course, and I think there's another question about kids' meals, so I can touch on that a little bit, but because it relates here, which is, when we've engaged and the field has engaged in voluntary change work with restaurant change, we've seen that there's been mixed success, and some of the evidence, there's some good data. The Red Center, specifically at UConn, has looked at this and released some studies about when restaurants have said that they're going to make voluntary changes to their practices, whether or not that actually happens. See that the national company is at work, so online menus, for example, we see changes, but when a lot of these restaurants are franchised, and so what's happening at the individual restaurant level is often very different. I don't know, Jim or Javier, if you want to add anything to that piece.
Yeah, the only thing, Sabrina, to add is that there are some examples of at higher education institutions where students have actually gotten active in pressuring their administrations to drop the pouring rights contracts with Pepsi or Coke. And I think that's a really good avenue for activism on this. Another arena is monitoring city and state contracts, because they actually have pouring rights contracts for public facilities, often like at sports venues or other places, at public recreation centers and so on. And I think monitoring those and pushing cities and states to cancel their pouring rights contracts might also be a reasonable approach to take here.
I don't really know too much about this except for UCSF, UC San Francisco, and them eliminating sugary drinks from their facilities, and just the great health outcomes that they're having. That's the only thing that I know.
Thank you. The next question we have is about warning labels. What kind of information would be included on a warning label for sugary drinks? Sabrina, did you want to start us off with your thoughts on this?
Sure. So that's a great question, and I think the answer to that is somewhat in flux. I'm not going to go down the deep, dark hole of the litigation that's happening in this space, but San Francisco is the only city that has enacted a warning label policy, and they're currently engaged in litigation around that. The beverage industry and some advertising industry, sort of billboard industry folks have sued them about the warning that they have required. The warning that they had talked about diabetes, heart disease, and tooth decay. They recently changed the language of that warning in response to litigation to sort of use weight as a middle ground, because there's some thought that the evidence between sugary drink consumption and weight gain is stronger than the evidence between the evidence between sugary drink consumption and some of these longer term health outcomes. So I don't have it in front of me, but I can pull it up and follow up with the person that asked this question of the specific language they changed it to. We have a model that we have on our website for this policy. It uses the same language that the city originally used. There have been some suggestions in the court system that, for example, the warning shouldn't be about diabetes specifically, but rather type 2, or broadly, but rather type 2 diabetes specifically, and some other sort of commentary that we can take from the litigation that's happened. But the short answer is we don't have a definitive answer about what's legal, but certainly the things that one would warn about are the things for which there is the strongest evidence. So that may be a little bit vague, but the reason it's a little bit vague is because we don't have that definitive answer. That said, I'm happy to chat further offline with folks who are interested in this policy, because there's a lot to say about it and what's going on in that space right now. Great, thank you, Sabrina. Our next question is for any of the panelists.
how would you convince a restaurant owner to charge for any refills when they consider it good hospitality practice to serve free refills?
I think you pass a local soda tax that everyone is subject to the same requirements. You know, the interesting thing here is that you know, there's been some research done by Christine Madsen, and also some research done that's led by Dean Schillinger in San Francisco, that shows that a lot of our business partners are actually not opposed to a tax, especially when they know where the funds are going. And so, you know, I don't think it's so far-fetched to think that that we would be able to get by showing.
Great, thank you, Javier. The next question that we have is related to weight stigma's effect on health. Given that this is a webinar focused on equity, have ChangeLab and other organizations considered how the language they use around obesity and weight gain to justify the focus on sugary drinks might actually be stigmatizing to people in larger bodies and communities that are disproportionately impacted by chronic conditions? Did any of the panelists want to start us off with that?
Jim, do you want to start off, and then I'll chime in too?
Yeah, I think that's a really important concern, and there are a couple of thoughts I have on that. First, it's important to lead, I think, when talking about taxes specifically and SSP policies in general, around the benefits that the taxes can produce. And so they produce benefits in chronic diseases that communities really care about a lot. Diabetes, for example, tooth decay, and heart disease, and particularly diabetes and tooth decay seem to resonate with community members, and they understand intuitively the link with sugary drinks. And so I would tend to focus on those when talking about it. Second, for taxes, particularly focusing on the way revenues can be used to address important community priorities is really the leading message. And so I think that helps address that as well.
Yeah, I would say that this is definitely something that we're thinking about internally at ChangeLab too. And for us, it's come up very acutely in the context of what I just mentioned about the warning labels and the way that the language has changed in San Francisco, for example, that does specifically mention weight. And while there may be a stronger evidence in that connection between the consumption of sugary drinks and weight gain, I am concerned about the stigma effect of that. And ironically, I actually have a call scheduled later today with one of the lead researchers that works on stigma and the law and the effects of stigma in the law and communications around policy to discuss this very issue. So if whoever asked that question and folks more generally are interested in that, I'm happy to again follow up after that conversation. And this is something that's very much on our minds and in conversation for us.
Thank you, Sabrina. I want to be mindful of time, and I think those are all the questions that we have time for right now. But thank you everyone so much for joining. Please be sure to look out for an email with a link to the recording of the webinar. And I'll be also working with the presenters to make sure that we provide resources and answer many of the questions that come up. If you have time, we would greatly appreciate it if you filled out the post-webinar survey that you'll be receiving soon. Thank you so much, everyone, and enjoy the rest of your day.